Kenya and Africa at large are struggling with the triple burden of malnutrition, undernutrition, overnutrition or obesity, and micronutrient deficiency. Today we're having a workshop on food fortification here at the Samara Hotel in Machakos. And I want to take you through what the workshop is all about. Welcome. I managed to talk to some of the participants who attended the workshop, and this is what they had to say.
My name is Paris Nkale. I am a program officer in the Directorate of Health Promotion. Specifically, I'm Assistant Director for Health Promotion. I work in the ministry headquarters. Up to this time, we are here to support the development of communication materials in aid of the program of food fortification. So, food fortification means that there are certain micronutrients that we have to hand to food so that in the process of people feeding, we consider the fact that certain micronutrients that have been found missing in science, in research that have been done, are given an avenue to be included in the food. Some of those which are very important and indeed necessary for the body include things like zinc, iron, iodine, vitamin A, yes, various types of vitamin B, which we realize that the body really need, and they are not in sufficient quantities in the food that is available.
So does that mean that the foods that we are eating, they do not have adequate micronutrients?
The food that we eat does not have adequate micronutrients, and therefore that is why we have deficiencies in some of these micronutrients to people who are otherwise well fed.
Okay. Is it only for those people who are our rural folks, or does this apply to everybody?
It applies to the entire population, those that are living in the rural areas, and also those who are living in urban setups.
Okay. I can see they are dressed differently. What does that really mean to us?
It means all of us must get concerned about fortifying food and including all these micronutrients in the food available to our people, so that we can deliver this to improve on the health of our people.
Yeah, I think it also means that we need to unpack from the routine work that we have been doing, those difficult roles that we play, and just narrow down to being a common person, because we are all going to feed on these foods that we are talking about.
Exactly, and that is why we are spotted like this, so that we can remove the seriousness in our face to people who are otherwise concerned, visually or otherwise, about the health of our people, and in particular now including the specific micronutrients which are very, very important and vital for our health when they are included in our ordinary diet.
Okay. So as a health promoter, what are some of the things that should be done so that we are able to ensure that the community members are able to eat these fortified foods?
In advocacy, we want to target government and various millers so that they can assist and support to have that the food that reaches the consumers or the customers as the necessary micronutrients. Thereafter, then we shall ensure that we reach out to our population through various ways of sensitization so that we can actually have them make informed decisions on how to assess the fortified feeds for their use.
Okay. Thank you, Faris. Is there anything else you want to add?
I cannot add much, but it will be interesting if we can have Kenyans assess the necessary micronutrients through the process of food fortification. I would be interested to see every player pertinent and serious in this for the welfare of our population. To the ordinary people, we would want you to understand and appreciate the need that you need to have demand for food which is fortified, Hong to giving you micronutrients which are very important to give you health, which is a prerequisite for our development.
Thank you so much. You have heard it's all about the health and well-being of all of us.
Thank you.
Who are the most vulnerable? Which food vehicles have been used for food fortification? And what does this mean to us as a community?
Good afternoon, my name is Dr. Susan Onyango, and I want to speak briefly about food fortification. So food fortification is very important to the community. It's important for us, for all age groups, and more so the children and the women. We find that women and children suffer more. They suffer from micronutrient deficiency. So when food is fortified, you find that there are those additional minerals and vitamins that are added into food, and of course this food will not like change the color or the taste, but it adds on to these micronutrients, and therefore this population will not be deficient of these very important minerals and vitamins. It helps in preventing and controlling micronutrient deficiency. Now, what does this mean? When micronutrient deficiency are prevented or controlled, then we end up with a healthy population, healthy women, healthy children, and this results into overall good health. Generally, what does it mean to the entire community, to the country at large? It means increased productivity, and this one therefore it means that our economy will also grow. So therefore I urge everyone just to focus on or at least prioritize foods that are fortified. The vehicles that are used, mostly foods that are fortified, are the maize flour, the wheat flour. We have the fats and oils, and to some extent sugar. So I am urging everyone, join the bandwagon. Food fortification is very important for us in the community and the country at large. Thank you.
In Kenya, we have a fortification logo on the maize flour, on the wheat flour, and also on the iodized salt. Even though we have this fortification logo on the industrial flours that are milled and put in the shelves, most of the homesteads, most of the families trust the flour that they have milled in the nearby posho mill. So this remains a challenge on how to convince the community that the flour they make from the nearest posho mill is not fortified with iron. Though it is whole grain, it is good for health but not fortified. Thank you for watching, and if this was your first time, kindly subscribe to the African Moms channel. See you in the next one.